The Honourable Rod Caddies.
Thanks, Chair. I refer to page 308 on the budget paper number 2, volume 1, line item 17.4. A $3.4 million investment in addressing misconceptions on vaccinations. Now, on May 3rd, 2021, the Honourable Mark McGowan claimed that COVID vaccinations were safe and effective. The vaccines went on to be linked to myocarditis, pericarditis, thrombosis and anaphylaxis, amongst other things. Can the department confirm inaccurate statements about COVID vaccines in the past have contributed to vaccine hesitancy?
Minister, I'll send that to you.
Thank you very much. I will ask Dr Robertson to provide an answer to that question.
Dr Robertson.
So the COVID vaccines, continue to be used and continue to be safely used. As with all vaccines, and for that matter, all medications, there are some side effects and some serious side effects. They've been acknowledged, and it's probably the best studied of all of the medications that are used currently. The program continues to be supported by the Commonwealth Government, and it continues to be adopted. It's certainly continuing to provide good protection, particularly in the elderly and the more senior part of the population. With regards to vaccine hesitancy, there has been some vaccine hesitancy that we have noticed, and that has been seen across a number of vaccines. That is slowly changing. There has also been considerable misinformation and disinformation about those vaccines, and that has also contributed to vaccine hesitancy. COVID itself, or the COVID vaccine, the recommendations for that have changed over time, and you'll be aware that it's not recommended for all age groups now, and it's mainly recommended over 65 and over 75.
So then would past statements regarding the COVID-19 vaccines, specifically that they were safe and effective, be considered misconception that they would be targeted, such as the assertion that COVID vaccines would stop the spread, which they clearly didn't?
Member, I'll just note, this is a guidance. This is guidance from the chair, and this can be a fine distinction on occasion, but I think you are clearly seeking an opinion you are clearly seeking an opinion from a witness, which is contrary to the procedure policy of this estimates hearing. You can direct those sorts of questions through the minister, and the minister will deal with them. So that's just some advice. You might like to rephrase the question.
Okay, does the department accept that the language used by health authorities and politicians during the COVID period was not appropriate, considering many people understood safe and effective to mean that vaccines were completely safe and effective, given that this is about misconception, that there's going to be $3.4 million spent towards vaccine hesitancy campaign, which addressed misconceptions and vaccinations. So the misconceptions that people have got, does the department accept that the language used by the health authorities, them things are going to be targeted as misconceptions, things that have been said in the past?
To facilitate the flow here, I might direct that question to you, Minister.
Thanks very much, Chair. I was going to point out Standing Order 182, which says an officer of a government agency should not be asked to give an opinion on a matter of policy. I'm not going to resolve from the fact that during COVID-19 some difficult decisions were made, but the reality is many people across the world died as a result of COVID-19. For people to be, if they're suggesting that this is not real, That's absolutely wrong.
No one's suggesting
well,
it's not real.
I'm answering the question. You've asked the question. I'm providing an answer. In relation to the vaccine public information campaign, this was developed in response to a recommendation of the independent review of Western Australia's COVID-19 management and response, that a campaign was required to counter vaccine misinformation and disinformation. So what the campaign is about is providing proactive public health messaging, including on vaccinations and immunisations, which is a public health prevention strategy. There's no doubt that vaccination helps stop the spread of disease. It reduces the number of hospital admissions and it eases pressure on the healthcare system. And after the challenging few weeks we've had, I couldn't think of a better campaign to run at the moment.
Member, still your time.
That's all. Thanks, Chair.
Thank you. The Honourable Phil Scott.
Turning to page 304, Vaccine Hesitancy Public Information Campaign, 3.35 million is a substantial amount of taxpayer money.
Just that again.
What benefit did the taxpayer receive and how does the government actually measure the benefit?
Minister.
I'm just trying to find my page again. Is it 39? I guess, honourable members, so this is about, as I indicated earlier on, it is about helping stop the spread of disease, reducing the number of hospital admissions, and it eases pressure on the healthcare system. So, you know, we will conduct post-campaign research between the Department of Health but also the Department of Premier and Cabinet to determine the effectiveness of the campaign and to inform any future campaigns. So that work will take place. The campaign commenced June last year and it just finished June this year. So the analysis is being done at the moment. But the reason again for doing it was to help the health system, stop the spread of disease, reduce the number of hospital admissions and ease pressure on the healthcare system more broadly.
Thank you, Minister. I note that ATAGI now recommends healthy young people under the age of 18 should not be vaccinated for COVID-19. Given this is the case, will the WA Government fund a public information campaign to let them know the previous advice was incorrect and so-called vaccine hesitant parents were correct in not getting their child vaccinated for COVID-19?
No.
Next question, member.
Okay, page 305.5. It states that Western Australia's strong population growth has increased demand for services. Given WA's health system is currently in crisis, does point 5 acknowledge the mass overseas migration policy of the Commonwealth is stretching WA's health system beyond capacity?
Minister.
Thanks very much. No, we don't. And to suggest that population growth is totally subject to people coming from overseas is totally wrong. We have seen over the past couple of years, in particular, a significant shift of people from the east coast of Australia coming to Western Australia because of the strength of our economy. Our mining sector is nation leading and continues to employ hundreds of thousands of people. And while we had a border during the COVID-19 period to keep sickness out, there's no plan to put a border in again to keep Victorians out. As much as I'd love their football teams to stay away from time to time.
So you don't accept there's any impact at all?
Honourable member, the state that their percentage of people born overseas now is less than the percentage of people who were here, born overseas, who were here in the 1800s. So this state has long had a reliance on people from around the world. That's to keep our economy flourishing. That's to keep our minds open. That's to provide services in our health system. So no, I don't agree with the premise of your question.
Okay, just finally, page 322, line item COVID-19 medical equipment. What exact medical equipment does this refer to? And what was the $47,000 spent on in the past financial year?
Minister.
So, you know, so COVID-19 medical equipment, so it's completed works. That's 48. And remember, look, it could be for things like PPE, potentially for ventilators, but we would have to look into it. That level of detail on something like that wouldn't be in our file, given it is completed work, so it's kind of past tense. If the honourable member was after that, we could take it as a supplementary piece of information, and we'll see what we can.
Thank you, Minister. I'll do that.
Okay, and that'll be C12, and I'll move on to the Honourable Marika Gronwald, please.